Hey everyone, Cynthia Beasley here in our First Alert News Center. We have an update to a story that impacts a lot of South Carolinians. An audit has found that SLED's sexual assault kit tracking system is inefficient and went through a lot of points and issues with the program. So you may remember back in 2020, the legislator passed a law requiring SLED to make a tracking system for these sexual assault kits. And SLED did not meet its deadline of June 1, 2022 to implement that tracking system. It actually wasn't fully implemented until February of 2024, which was 21 months after the deadline. So the Legislative Audit Council did this audit after members of the General Assembly requested that they do this audit. There were concerns over how the program was being rolled out. So we're going to take you through some of their findings right now. We're going to pull up a graphic here. So the big takeaway here is they're saying that justice is being delayed or denied for victims, many of whom are younger than 18 years old. So here are some of the key things they found. They said that there's incomplete data in the system. So SLED, they're also saying, can't verify the number of untested sexual assault kits across the state. So some of the data that they looked at, they said as of July 1, 2024, Track It, that's the system to track these kits, recorded 763 kits in the system, but they say as of October 2023, there were more than 1,900 kits pending testing in just SLED's lab. So statewide data in Track It is incomplete, again, because they also said that as of July 1, 2024, only 64% of law enforcement agencies and 50% of medical facilities had actually enrolled in the system. So states can't get rid of the backlog, this audit says, without knowing how many kits are not untested, basically saying that there's no way to really know how many kits there are. The next thing that they said, SLED hasn't established guidelines as the operator for the tracking system. So they're saying that making a website and a statewide manual that has timelines so that survivors can look at the manual, they can look at the website, and they can see where the kit is, and also kind of lay out who's accountable for what. You know, they can see where their kit is in the system. This audit said not only would that help survivors, but it would also add accountability and minimize errors. And, you know, so that's from the standpoint of the survivor. But they also said SLED just doesn't have an overall dashboard. So when it comes to the public, the council says an online dashboard where people can go through it and look at the data county by county, agency by agency to see what's happening in their area with these kits. They say that would really encourage participation in this Track It system. They also say there is an insufficient number of sexual assault nurse examiners, so that's also referred to as SANE. The number of SANEs in South Carolina has dropped in the last 3 months, according to this audit. They also found that not every hospital has a SANE available, so some hospitals actually have to turn away sexual assault patients. Now, part of this that comes into play, according to the audit, is that there's no state law that requires hospitals to perform sexual assault forensic exams, so this is something that that audit says definitely needs to be taken care of as well. So another thing that brings us to this graphic that we have here. So right now, they say, the audit says, South Carolina is one of 6 states without a required time frame for processing the kit. So if we go to this next graphic here, it'll show you what they found, the average number of days for South Carolina. But as you can see, processing times are longer on average than the time frames that other states have under those requirements. They also found that anonymous sexual assault kits can be destroyed after 1 year of storage, despite there being no statute of limitations for sexual assault offenses. So that's against best practices nationally and isn't what other state guidelines do. So, but looking back at this graphic with the time frames, you'll see there at the very bottom, it says the length of time from receipt of at a laboratory to completed forensic analysis. Average number of days in South Carolina, 457 days. Majority of other states, their requirement is that it has to be within 90 days. So to end the backlog, they are recommending that within 30 days of receipt at a laboratory. So some of the other long timelines that we're seeing there, also that first one, length of time waiting for pickup by a law enforcement agent from a medical facility, average days in South Carolina, 49 days, maximum 198 days. Compare that to other states that have requirements for this. They say it should be within 5 days or less. The best practice, of course, that says as soon as possible, but ideally no later than 3 business days. The next thing we're looking at there, the length of time from pickup by a law enforcement agency from a medical facility to delivery to a forensic lab. Average number of days in South Carolina, 32 days. Maximum number of days, more than 1,300 days. Compare that to other states with requirements, that's within 30 days or less. So definitely a lot of findings from this audit, again, calling the system inefficient. And one of the big takeaways from that, they're saying that justice being delayed or denied for victims, many of whom are younger than 18 years of age. So not only, as we've covered in the past, they had that deadline that they were 21 months behind to reach, but now this audit is finding a lot of inefficiencies in the system that they say is directly impacting survivors and victims. You can read this whole report on our website, wistv.com, and we'll of course be following this and seeing what happens next for this program. Thanks so much.